is herd immunity. I believe you're alone in that.
It has been over. The pandemic stretches on. We're all feeling the impact. Sharon Kiely is Chief for HealthCare. Doctor, thanks for joining us this morning.
Thank you so much for having me.
Wellness officer, particularly.
The Chief Wellness Officer in the United States, there are only about 20 Chief Wellness Officers here in the country that are to take care of the wellness needs of all of their population. To team of people. COVID, I would say anyone has what people are experiencing in the period of time and meeting their needs. Child care, housing, for mental health that people are experiencing.
And I would imagine, Doctor, it begins internally. In other words, for your doctors and nurses and hospital staff for care to the consumer, in this case, to the patients, come first. How have you helped them, and how are they doing?
I would say that we are doing quite well at Hartford HealthCare. We actually measured how our employees were doing mid-pandemic. And as you know, pandemics take a long time to of what the impacts will be. We don't know what those impacts will be, but we felt it was really important to understand the emotional well-being of our colleagues. And so we measured a time frame. And what we couple of things. Number one, staff felt that we cared, that thing, which is also quite protective in terms of impact. To do their job well, and the answer in that focus.
Minute for the rest of us outside of Hartford HealthCare, all of us on some level, if we're being honest, are struggling with our mental health in a pandemic. These are not normal times. What are 2 or 3 things that we can do ourselves, or maybe for ourselves during these challenging times?
Sure. There are 3 ways that I recommend building knowledge, expanding your mind. The second thing is coping. Prioritize your rest, your hydration, your nutrition. Think about things that are filling your sails as opposed to things that are taking the wind out of your sails. Don't do those other things. And finally, I cannot underscore social supports. We at Hartford HealthCare have a peer support program for our clinicians. They can call a one-call number at any time and be connected to social support because your colleagues, your trained volunteer colleagues, know what you're going through. So we'd encourage the clinicians to call that line. And for the rest of us, these things apply as well. This is what I apply in my personal life and what I recommend to my colleagues and family.
Some terrific information. Dr. Sharon Kiely, Chief Wellness Officer at Hartford HealthCare. Thanks for your time and be safe. We appreciate it.
Thank you.
Let's take a look.